So recommended dietary allowances called as RDA. Before we jump onto RDA, we should know what is EAR, that is estimated average requirement. Okay, EAR, estimated average requirement. You should know the meaning of that, then you will understand what RDA is. Okay, so let's say we have 1.6 billion population. Okay, India's population is around 1.6 billion. Okay, so do the half of it. What will be the half of 1.6 billion? Around 800 million, right? Anyone else with any other numbers? Half of 1.6 billion. Okay, whatever is the half of 1.6 billion, estimated average requirement will give you the average requirement of half of your healthy population only. Yeah, 800 million, 80 crores or 800 crores, I guess. Just cross check that. So whatever is a given population of any geographical region, okay, for let's say for example, just speculative example, 100 people. So out of this 100 people, 100 healthy people, okay, it's taking an assumption that all of these 100 people are all healthy. Okay, out of this 100 people, what is the average nutritional requirement required for 50 of these people, half of the population? Okay, average nutritional requirement of half of your population is what we call it as estimated average requirement to keep at least half of your people healthy, half of the nation healthy. Okay, how much nutrients you would require, the amount of nutrients you would require to keep half of India healthy. Okay, that's your estimated average requirement. Okay, so first you find out what is the like average requirement, what is the estimated average intake of nutrient for your entire geographical region. Only then you can find out RDA. Okay, so RDA is based on, first you have to find out actually how much food your people are having. Okay, how much food your population is having, how much nutrient per day the entire country is having in terms of carbohydrates, fats, proteins, minerals, vitamins, etc., all macronutrients, how much actually the people are having on an average basis, and from that average will determine what is the recommended daily allowance for them. Okay, so uh, estimated average requirements only set for nutrients that have functional markers. Okay, the nutrients that are functional in, for example, vitamin C is a functional nutrient, iron is a functional nutrient. Okay, so they all these functional nutrients, they have a set markers on them, and EAR determines that. So it meets the needs of 50% of the population group, and it forgets about the remaining 50%. Okay, so on the, if you just follow EAR to give guidelines, to give like for example, somebody comes to your clinic, okay, comes to you for nutritional counseling, etc., and based on the values of EAR you're recommending, okay, you should have only 0.8 gram of protein, you should have only 1000 kilocalories per day, something like that. Okay, you are just covering half of their health, you are not giving 100% of coverage to their health. Okay, so that's about EAR. Now coming to RDA. RDA is definitely based on EAR. You can't find recommended daily allowance until and unless you find estimated average requirement. Okay, so but RDA will meet around 97 to 98% of the population group. It will, when you follow RDA, you are covering around 97 to 98% of your entire population. Okay, but in EAR you are only covering 50% of the population. Okay, and what RDA does is, it not only prevents deficiency diseases, it also prevents keeps the population protected against degenerative diseases like multiple sclerosis, etc. Okay, so while having EAR, okay, while having the food that is given by EAR, one can survive. Definitely one can survive, but survival is not health. To be healthy, to be free from deficiencies, to be free from diseases, to be protected against degenerative diseases, you require RTA. So that's the difference between EAR, estimated average requirement. Keep in mind the name average, okay, then recommended daily allowances. So in this graph, you can see where EAR is. Okay, just corresponding to the EAR, you can see here it's mean median. This is a normal distribution curve. Okay, statistics, this is a normal distribution curve. So in normal distribution curve, the mean, median, mode, everything comes in the center, and standard deviations plus or minus standard deviations are on the side. Deviations means the numerical values that are far away from the average. Mean means average. Okay, so estimated average requirement, average means mean. So the entire Indian population, let's say in terms of protein, the entire Indian population, their average intake of protein may be so and so percentage. Okay, it is coming in the center. Okay, but we definitely know that the protein intake of the entire Indian population is not adequate. This estimated average requirement will just show you the current statistics of how people are having food. Okay, the average nutritional value of the food that people are having. Okay, it helps them for their survival, but it is not protecting them against any diseases. So always the RDA will always be greater than the average. Okay, you can see here the RDA is on the plus side. Plus side means it is always on the greater side. RDA is always the upper limit of nutrition you should have. If you go beyond the recommended daily allowances, let's say 1 gram of protein per day is what was allocated to you, 1 gram of protein per kg body weight per day, that's what you should have. But if you are going to have 2 gram of protein per kg body weight, 2.5 gram or 3 gram, something like that, more than what the ICMR has given you, the RTA, more than that requirement if you are having, you will definitely contact some diseases. Okay, some toxicities, some protein overload, proteinuria, your kidney may fail, something like that. Okay, so already RDA means like if RDA says exactly 800 mg of calcium you should have, or 1000 mg of calcium you should have on a daily basis, you can't exactly keep a count of meeting that requirement. 1000 mg of calcium or 800 mg of calcium every day, you can't keep a count of it. You can definitely be below 200 or 100 in that count. Okay, you can have 700, you can have 600 mg, that's not an issue. But once you go beyond the RTA, like you have 1200 mg of calcium every day on a daily basis, that's what will be problematic, because RDA is always already the upper limit of the nutritions which you should have. EAR, estimated average requirement, is just for your survival. It will just keep 50% of your population healthy. Okay, it will just completely forget about the remaining 50% depending on their age, sex, health group, etc. Okay, so but RDA, whatever the values RDA gives, okay, if you follow that, if the country follows that, 97 to 98 percentage of their population is covered health wise. So that's a difference between EAR and RTA. EAR, in the name itself, you can see there is an average. Average means average intake of nutrients what the entire country is having. But the usually average intake of the nutrients what the entire country is having is just the reality, but it is not the health. Okay, it's just the reality. And RDA usually will be always greater than the reality. Okay. So factors affecting RDA, obviously age, sex, height, weight, geographical location, availability of food, economic status, physical activity, these are there. Apart from this, some intrinsic factors also we'll discuss here. On page number 16, it is given in detail. So variability in nutritional requirement. depending on the age, the kind of nutrition a growing child, a preschooler requires is different from the kind of nutrition a teenager may require, different from a kind of nutrition a senior citizen may require. Okay, so depending on their age and sex, lactating mothers, they require a specific kind of nutrition, a specific kind of calorie intake, different from a woman who is in the first trimester of a pregnancy. With the increase in trimesters, there will be an increase of 300 to 400 kilocalories which she has to take in. Okay, so like that, it depends upon the nutritional requirement. Okay, so that is why if you have seen, okay, uh, RDA will cover 97 to 98% of the entire surface area which you have seen in the previous graph. Okay, in the previous graph of normal distribution curve, okay, if you take the entire surface area which is below the curve, RDA will cover 97 to 98 percentage of the surface area of a normal distribution curve. But EAR will not cover that. EAR will cover only 50 percentage of the entire surface area of the normal distribution curve. That's the difference here. Okay. So depending on the nutritional requirement, depending on the age, depending on the physiological functions that which your body is undergoing as of now, for example, pregnancy, okay, depending on that, your requirement will change. So you take any you just take any chapter in your nutrition science textbook. Okay, macrominerals, microminerals, or vitamins, carbohydrates, fats, proteins, etc. Just take any chapter, go to the tables which mention the RDA which the ICMR has given. Okay, so ICMR has clearly made distinctive part of how much intake a woman should have, how much is the intake of a specific nutrient for man, for women, for teenagers, for children, preschoolers, infants, also people who are in sedentary lifestyle, moderate lifestyle, active lifestyle, how much they should have. Okay, so already it is given. So RTA completely depends on your personal requirement. Bioavailability, it means the absorption of nutrients. We can just generally we can say that plant-based foods, okay, the nutrient quality of the plant-based food is not as readily absorbed as you compare it to animal sources. Okay, not for all nutrient, but majority of the cases, like fats, proteins, minerals, okay, which you find in animal sources is much more bioavailable as compared to plant sources. So that is bioavailability, the way how your body is going to absorb the same nutrient from different sources. Okay, so that's the bioavailability. Whatever you have, if you have 100 gram of plant protein, 100 gram of animal protein, your body will readily accept and absorb and digest the animal protein much easily as compared to the plant protein. So that's the example of bioavailability. So obviously bioavailability of every food is also a factor in determining the RTA. That relationship between nutrients, okay, like for example, we have seen how vitamin C, the presence of vitamin C enhances the iron absorption. Okay, the presence of vitamin C enhances the iron absorption. The presence of calcium, it decreases the iron absorption. So this is just one example of a relationship between nutrient. Okay, so if you are just going by RDA, you are having this much gram of vitamin C, this much gram of iron, this much gram of calcium, what the RDA is giving. But still, if you are not healthy, because the reason will be the nutrients which you are spacing, the nutrient spacing in your entire diet is not adequate, it's not functional. Okay, so general principles which we follow while determining RTA. First is dietary intakes. Energy intakes of a normally growing healthy children are utilized for this purpose, to identify how much should be the dietary intake. Okay, like children, when they run, jump, they grow. Okay, they have a short, much more effective energy intake. So depending on the child's energy intake, we'll see will determine how much a preschooler should require, how much calories a preschooler should require, how much calorie school going children should require, how much calorie an adolescent should require. Okay, so this growth factor in children was one of a key principle while determining RDA for the entire country. Okay, every country has their own RDA. In India, we follow what the ICMR gives us. Okay, so the RDA which is followed in USA. Okay, if you go to any sources or articles given by USA, you will find RDA. So there will be slight variation. Okay, the nutrient requirement for people living in USA is slightly different from what you expect in India. Okay, so geographically speaking, RDA is different for different nations. Then growth. Okay, the breast milk intake of newborns and during in early infancy. Okay, how the child gained weight just with the help of breast milk. That principle was also taken into consideration. Nutrient balance, the like intake and output. Even if you're having 100 gram of carbohydrates in a given food source, the entire 100 gram of carbohydrates will not be absorbed by the body. Okay, some of it will be directly excreted. So that is nutrient balance. There is an input versus output graph. Okay, obligatory loss of nutrient. For example, even by metabolism. Okay, even after metabolism or before metabolism, some part of the nutrient will be lost. Okay, by while urine, through urine, sweating, excretion, etc. Okay, or some nutrient will be lost in the form of um, being a byproduct in other chemical reactions in your body. Okay, so that is one obligatory loss of nutrient that is also considered. We know that if we have this much of carbohydrate, this percentage of carbohydrate will be lost from the body. So keeping that in mind, how much carbohydrates we should uh, additionally supply in our diet, like that. Okay, then we have factorial approach. For example, usually we use factorial approach for people who are having certain illnesses, who are in a recovery state. Okay, for example, after a surgery, post surgery, um, the patient will be suggested multivitamins. On top of that, some additional supplements of vitamin C, especially if there is a deep wound or a scarring which has to be prevented post surgery. Okay, so that is a factorial approach. Okay, this much multivitamins we are giving you for your neuron generation. Okay, to regenerate your neurons. This much vitamin C we are giving you just to help you in wound healing. Okay, this should be your calorie intake, so that you do not you do not put your digestive system into a state of too much work. Okay, like that. That is a factorial approach. Usually you will use factorial approach in treating certain illnesses or in recovery phase, etc. Okay, every nutrient which you put in the menu plan or a diet plan of a patient, okay, it has a specific function that the nutrient has to do in the uh, in the body. You are not blindly prescribing them anything. You are exactly prescribing them vitamin supplements or nutritional supplements with a specific function in mind. So that is factorial approach. The nutrient turnover, data of turnover in healthy person is taken in consideration, and then depending on then on a healthy person's intake of nutrient and a person who is deficient in the same nutrient. Okay, determining the difference in that, how much additional nutrient a deficient person should have to reach the same kind of health this healthy person had. Okay, so that is nutrient turnover, just adding the exact same amount of nutrient to match the healthy person's intake, so that a similar health can be achieved. So that is nutrient turnover principle. Then we have depletion and repletion studies. So depletion study, first we'll go to the depletion aspect of it. So first you take a individual, usually in the animals who are used in laboratory and all. Okay, like the guinea pigs and rats and mouse on whom various tests are conducted. Okay, they usually undergo depletion and repletion studies. Okay, so in depletion studies, what you do is you starve the subject. Okay, you starve the subject to the state that the subject reaches deficiency. Okay, the subject reaches deficiency. The subject can be human subjects or animal subjects. Okay, so you starve the subject, not like not giving them food or anything like that, not like that. You are purposefully taking a specific nutrient out of their diet. Okay, and you starve them out of that particular nutrient for a given period of time, and on a regular basis you will do the blood analysis, serum analysis, and as soon as they reach the deficiency level, okay, after you will stop the procedure. Okay, after, as soon as the subject has reached the deficiency level, from that day onwards, slowly you will reincorporate that nutrient. Okay, slowly you will reincorporate that nutrient which you essentially removed earlier, and then you will again do the serum analysis and blood analysis to see uh, if you give this subject 10 grams of this particular nutrient today, what how does the blood report shows off. Okay, after 5 days, how, what will be the blood report. Slowly you will increase the micronutrient till the time the subject reaches a adequate level, a healthy level of this particular micronutrient which was removed initially. So with this graph, this is the study. You will collect the data at each and every step, at each and every depletion step and each and every repletion step. So with these studies, we can understand how long it takes. Okay, how long it would take for a person who is deficient in a particular nutrient to regain their health in that specific criteria. So that is the reason why when you are put on a, let's say, biotin, okay, or if you are put on um, intravenous vitamin B complex injections, okay, there are a specific amount of injection that the physician will recommend it to you. Okay, not more than that, not less than that, and after the entire dose they will ask you to redo the test. Okay, so just to make sure of it that these are the tried and tested things which we do in healthcare. Okay, we know what are the depletion result and how to replenish the body in that nutrient, how long it will take, and exactly how much amount you should give to the patient so it is tolerable and you can achieve health. Okay, so that is depletion and repletion studies. In depletion part of this study, you will starve the subject out of the nutrient just to check at what stage this subject will reach deficiency. As soon as the subject reaches deficiency, slowly you will incorporate part by part on a daily basis, 10 gram, 10 gram, 10 gram, 10 gram on day 1, 20 gram on day 2, 30 gram on day 3, like that. Okay, it may depend on the gram value, it will depend on the study. I'm just giving you an example. Okay, so slowly in repletion stage, slowly once the subject is deficient, slowly you will incorporate the micronutrient in their diet slowly, and you will take note of the changes in the blood serum level, etc. Okay, also external symptoms as well as the physiological symptoms, you will take a note on that. On a daily basis, blood will be drawn, given for analysis, something like that, and you will see the increase of the micronutrient even in the blood serum level. So you will understand, okay, giving them 30 gram of just increasing 20 gram of this micronutrient didn't give any result in the blood analysis, but increasing the but increasing the micronutrient by 50 gram, only then it showed up in the blood result. Like that, you will get that kind of data through this repletion and depletion studies. Okay, so these were the principles which we had used to determine RDA. The ICMR will follow up with such studies. Okay, they do conduct a lot of studies based on RDA, because that is the reason why, if you see the history of RDA, every 2 years or 3 years the RDA tables are updated. Okay, like what we have seen in calcium. Earlier it was 500 grams, 500 mg of calcium per day. Then it became 600. Now it is 800. Now people are also giving that, increase it by 1000 mg, like that. Okay, so RDA studies go this free undergo so many updations on a regular basis of time, that you have to, um, you can't depend on your textbook for that. You have to go to the ICMR site and download the file on RT, etc. What is the recent updation, etc. Okay, so keep an eye for that. Every year, mostly every 2 years or so, they do update the RTA table for Indian population. And why they're updating the RDA table, it is because of all the principles we have discussed so far. As we speak of now, there are so many depletion repletion studies going on, so many nutrient turnover studies going on. So whatever is the newest data, okay, whatever is the newest data one can collect, based on that, based on the results of so many studies, will update the RTA table. So that's what ICMR does. So determining RDA for various nutrients. For energy, there is no safe allowance for energy. Like, it depends upon what is your workout. For example, a person who has a sedentary lifestyle, 2000 kilocalories per day. Okay, but a person in the same age with the same weight, okay, same height, same weight, but the person is going for a marathon, okay, a marathon race, and he's a frequent marathoner, etc. So this person will have around 800 to 8000 to 7000 kilocalories per day. So there is no safe allowance. It completely depends on your physical activity. So energy does not have a safe allowance. So in proteins, when we'll go to the proteins chapter, we'll discuss about the DIAS score and protein quality index in detail. Okay, there is a protein quality index, DIAS score, digestible indispensable amino acid score, DIAS. Okay, so based on these scores, we determine which kind of protein is a high quality protein, low quality protein, exactly how much gram of high quality protein is essential for you on a day-to-day basis, etc. Okay, so we'll discuss in this about detail when we go to the protein chapter. Then about fats and oil, the Food and Agriculture Organization as well as the World Health Organization, they do various studies on this fats and oil, and whatever is the recommended allowances, or the studies they have done. Okay, the results of the recent studies, accordingly we will update it in the RTA table. Okay, so usually FAO and WHO are best judges, and they are the best sources from whom we can derive the recommended daily allowances for fats and oils. And even for sugar, these days, even for sugar, they can determine it. And minerals again, it depends upon one's personal intake as well as loss. Okay, if you are in a very active lifestyle, you sweat profusely, okay, you have some disorders like thyroid inadequacy, because of which you are in a condition where you sweat a lot. Okay, so your mineral intake will be different from an average healthy person's mineral intake. Okay, because a lots of minerals are lost because of urinary dysfunctions, kidney dysfunctions, or any other systemic issues. Minerals are lost in that way. So it completely depends on the intake loss value. Okay, so mineral intake, obviously we have an RDA for that, but again, on top of that, if you are suffering from any disorders which do interfere with your electrolyte and mineral level, okay, accordingly you have to replenish it. Again, vitamins, the same depletion and repletion studies which I have explained. Okay, for every single vitamins, the most famous one is all the B complex vitamins. Okay, all the B complex vitamins, the safe limit of niacin, riboflavin, thiamine, okay, pantothenic acid, etc. How do we determine? We determined using depletion and repletion studies on rats. Okay, this studies was done on rats over a period of time, and with that we could understand the essential role of each of these B complex vitamins. Okay, so vitamin D is the most famous one here in the depletion and repletion studies. Exactly the exact function of niacin, the exact function of riboflavin, the exact function of thiamine, one could determine this because of depletion and repletion studies. So what they may have done in those studies was they exclusively removed thiamine from the diet and they gave them all the other vitamin B complex. Over a period of time, they saw how the mouse is reacting. Okay, so with that, we could identify what exactly will be the symptoms of thiamine deficiency, riboflavin deficiency, niacin deficiency, etc. Okay, so that's how depletion and repletion studies helps with identifying what should be an RDA for vitamins. Okay, so for proteins, fats, minerals, vitamins, these are the studies which we depend on. These are the sources which we depend on to come to a final agreement on what an RDA should be. Again, since so many research is still ongoing on all these factors as we speak now, you may expect the RDA to change in the coming 2 years. Okay. So coming to the Indian reference man and woman, this thing you have to make note of. So this is given on page number 21. Indian standards for heights and weight, a table is given, can refer that, and reference man and woman is given on page number 23. Okay, so questions will come from this, so please make note of it. Okay, what is an Indian reference? Like ideal Indian healthy man, ideal Indian healthy female. Okay, what are the height, weight, BMI, and health criteria these people should fulfill? Okay, so the entire RDA, the entire workout routine and calorie requirement, everything, uh, we have come to an agreeable point we have come across is based on this benchmark. Earlier the weight was much less. Okay, for example, in early late 2000s, okay, in late 2000s you could see, if you go to any articles from that late 2000s, you will see the ideal Indian reference woman. Okay, here you can see the weight is around 55 kg, but in early and late 2000s the weight was around 50 kg. So the recent amendment, they made sure that there is an increase of 5 kg. Okay, so a whole lot of Indian population can be included in this reference criteria. So that is the reason why. And the age category which we use here, that is another important factor. Age is from 19 to 39 years, because India is a young country. Most of our population, okay, the average mean population lies in this particular age group, that is from 19-year-olds to 39-year-olds. So most of the Indian population is within this age group. So that is the reason why this age is considered here, and people under this age, okay, should be a reference healthy weight should be around 177 centimeters for men, 65 kilograms for men. BMI should be, when we calculate it, this should be the BMI 20.75. When it comes to females, 162 centimeters at least, weight should be around 55 kilograms, and BMI 20.95. Okay, and they should be physically fit, free from any diseases or any other infirmities. So that's a definition of ideal Indian reference man and woman. So practical application of RDA, like how do we use RDA on a day-to-day basis? So first we have the main uses to assess the adequacy of national food supplies. Okay, like the quality of wheat grains, for example, the wheat grains which is grown in India, compared to those wheat grains to the ones which is grown in USA or somewhere else. Okay, so is the wheat grains or the food supplies grown in India adequate enough nutritionally? Is it adequate enough to supply the entire nation? Okay, not in terms of quantity but in terms of quality also. Okay, so RD will help to identify that. So if at all there is any inadequacy in our national food supply, that's when bioengineering comes into play. Okay, genetically engineered foods and all. Well, those who have attended our previous classes, you must have seen that yellow tapioca, yellow rice. Okay, the comparison between white rice and yellow rice. Okay, so these are genetically modified food supplies which came into existence. Why? Because national food supply was not adequate. So we in those examples we are talking about African countries like Nigeria, etc., underdeveloped countries. But still, this RDA can apply for any country for that matter, to identify what exactly is the quality and quantity of your national food reserve? Is it adequate enough, or do you require any genetically modified foods to sustain the health of the entire population? Okay, so that's one use of it. Then we have to provide dietary guidelines. Okay, so because you will have an RDA a table with you, okay, on hand always. Whoever comes to you for dietary guidelines, how much protein should I have, how much carbohydrates should I have, like that, people will come and consult you on that. So your guidelines, your dietary guidelines will solely come out from the RDA table which you will use, okay, for this particular individual. So even if it is even if it is someone who is from another ethnicity, okay, who is living in India, okay, the non-residents of India, like any US citizens or any other country citizens, you have to refer their ethnic RTA for that matter. You can't give them the ICMR RTA table for people who are other than Indians. Okay. So to judge the intake, so like, is it adequate or not, like based on your food intake, are you deficient or not, or it is you are, it's in some cases people do have adequate intake of nutrients, but because of any other systemic factors they are losing a lot of nutrients. For example, irritable bowel syndromes, okay, peptic ulcers, okay, these are the disease conditions in which you may be having healthy food, okay, you may be having adequate nutritious food, but because of this underlying disease conditions, your stomach or your digestive system is not able to absorb them properly. Okay, so we can judge the adequacy of one's intake and identify any other diseases based on RDA. And RDA is not applicable for undernourished or malnourished people. For them, specific clinical guidelines is required. Okay, for example, uh, children who are suffering from PEM, protein energy malnutrition. Okay, so the whatever RDA amount of protein is given in the ICMR table, you can't use that to treat children with PEM. Okay, so they are severely malnourished. Okay, severely malnourished and undernourished children, they require clinical guidelines to come back to health. So you can't use RDA for severely malnourished or severely obese people. Okay, for a relatively healthy population with slight standard deviations, for them you can use RTA. Okay, on the other, on both the sides of the spectrum, people who are on the extremes of both the sides of the spectrum of health, severely undernourished or morbidly obese, RDA does not apply for them. Okay. Then we have My Healthy Plate. This was given by the National Institute of Nutrition, Hyderabad. For USA, they have a different healthy plate. It just has 4 segments. In India, given our indulgence in so many pulses, cereals, and legumes, this is the My Healthy Plate guideline, which National Institute of Nutrition, Hyderabad has given. The same image has been used in your textbook. What is the quantity of, like, if this is a single plate, okay, half of the plate is filled with fruits and vegetables, okay, and then only a little bit more than one fourth of the plate is with cereals, pulses, legumes, okay, then eggs, nuts and seeds, fats and oils, milk or curd. Okay, so this is for a average Indian family, average Indian healthy family. This is how a healthy plate should look like. Okay, the portion, servings, and all that you can determine just by looking at the plate. Any doubts here? Please put it in the chat.